In this podcast episode, Dr. Sarah Hill, a leading research psychologist and author, delves into the profound effects of hormonal birth control on women's lives, relationships, and identities. The conversation explores various aspects of how birth control pills influence attraction, emotional states, and even societal dynamics. Dr. Hill begins by discussing how hormonal birth control can significantly alter a woman's attraction to her partner. Research indicates that women who are on the pill may experience a shift in their preferences, particularly regarding the masculinity of their partners. When women are on hormonal birth control, they tend to be less attracted to men with traditionally masculine features, such as strong jawlines or deep voices. This change can lead to a disconnect in relationships, especially if a woman goes off the pill and finds herself more attracted to different types of men. This phenomenon raises important questions about the nature of attraction and how it can be influenced by hormonal changes. Dr. Hill emphasizes that these shifts are not merely superficial, they can have profound implications for relationships. For women who chose their partners while on the pill, the potential for decreased attraction upon discontinuation can lead to significant relationship challenges. This aspect of hormonal birth control is often overlooked, yet it plays a crucial role in understanding the dynamics of romantic partnerships. Another critical topic discussed is the impact of birth control on women's emotional states and mental health. Dr. Hill highlights that hormonal birth control can increase the risk of anxiety and depression. Women on the pill may experience a blunted emotional response, which can lead to feelings of numbness or disconnection. This emotional shift can affect not only the individual, but also their relationships, as partners may struggle to understand the changes in their loved ones. Dr. Hill points out that the hormonal changes induced by birth control can lead to a decrease in libido and sexual satisfaction. This decline in sexual desire can create tension in relationships, as partners may feel rejected or confused by the sudden change. The conversation underscores the importance of recognizing these potential side effects and understanding that they are not a reflection of a woman's feelings toward her partner, but rather a result of hormonal influences. The discussion also touches on the role of testosterone in both men and women. Dr. Hill explains that testosterone is often associated with masculinity and sexual desire, but it is also crucial for women's sexual health. Women on hormonal birth control experience lower levels of free testosterone, which can contribute to decreased libido and sexual satisfaction. This hormonal imbalance can create a cycle of frustration and misunderstanding in relationships, as partners may not fully grasp the underlying biological factors at play. Moreover, Dr. Hill emphasizes that men's testosterone levels are also influenced by their environment and relationships. Men may experience fluctuations in testosterone based on their partner's hormonal state, which can further complicate the dynamics of attraction and desire. This interconnectedness highlights the need for both partners to understand how hormonal changes can impact their relationship and sexual health. Dr. Hill provides an evolutionary perspective on the dynamics of attraction and mating preferences. She explains that women have historically preferred partners with resources and status, a preference rooted in evolutionary biology. This hypergamous tendency, where women seek to mate up, can create challenges in modern dating, especially as more women achieve higher education and financial independence. The conversation explores how these evolutionary pressures continue to shape contemporary relationships and mating strategies. This evolutionary lens also sheds light on the mating crisis that some researchers have identified, where educated women struggle to find partners who meet their standards. Dr. Hill argues that understanding these evolutionary dynamics can help both men and women navigate the complexities of modern relationships, fostering empathy and awareness of each other's needs and desires. The podcast delves into the broader societal implications of birth control use among women. Dr. Hill notes that the birth control pill has been instrumental in advancing women's independence and opportunities, allowing them to pursue education and careers without the fear of unintended pregnancies. However, this empowerment comes with a cost, as hormonal birth control can alter women's identities and relationships. Dr. Hill emphasizes the need for a more nuanced conversation about birth control, one that acknowledges both its benefits and potential drawbacks. By understanding the social implications of birth control, society can better support women in making informed choices about their reproductive health and relationships. As the conversation progresses, Dr. Hill discusses alternatives to hormonal birth control that women can consider. She highlights options such as the copper IUD, which does not alter hormonal levels and can provide effective contraception without the associated side effects of hormonal methods. This alternative allows women to maintain their natural hormonal cycles while still preventing pregnancy. Dr. Hill encourages women to explore these options and to have open conversations with their healthcare providers about the potential risks and benefits of different contraceptive methods. By empowering women to make informed choices, society can help mitigate some of the negative effects associated with hormonal birth control. Throughout the podcast, Dr. Hill emphasizes the importance of communication in relationships, particularly when it comes to discussing birth control and its effects. Partners should feel comfortable discussing their needs, desires, and any changes they may be experiencing due to hormonal influences. Open dialogue can help foster understanding and empathy, allowing couples to navigate the complexities of attraction and desire together. Dr. Hill also highlights the need for partners to educate themselves about each other's hormonal cycles and how they can impact their relationship. By being informed and proactive, couples can work together to maintain a healthy and satisfying relationship, even in the face of hormonal changes. The conversation touches on the future of women's health research, particularly in the realm of hormonal birth control. Dr. Hill advocates for more research into the long-term effects of hormonal contraceptives on women's health and well-being. She emphasizes the need for a more comprehensive understanding of how these medications impact women's identities, relationships, and mental health. Dr. Hill's call for increased research reflects a growing awareness of the complexities surrounding women's health issues. By prioritizing research in this area, society can better support women's reproductive health and empower them to make informed choices about their bodies and relationships. Dr. Hill discusses the role of fathers in shaping women's identities and relationship dynamics. She notes that women who grow up with involved fathers tend to have healthier relationships and better self-esteem. Conversely, those who lack paternal involvement may struggle with issues related to self-worth and relationship satisfaction. This discussion highlights the importance of father-daughter relationships in shaping women's experiences and choices. By fostering strong, supportive relationships with their daughters, fathers can help empower them to navigate the complexities of relationships and reproductive health. The podcast concludes with a reflection on the interconnectedness of gender dynamics in relationships. Dr. Hill emphasizes that understanding women's hormonal health is not just important for women, but for men as well. By fostering empathy and awareness of each other's experiences, both partners can work together to create healthier, more fulfilling relationships. This interconnectedness underscores the need for open dialogue and education about hormonal health, attraction, and relationship dynamics. By addressing these issues together, couples can build stronger connections and navigate the complexities of modern relationships with greater understanding and compassion.